Very big welcome to all of our attendees this morning. We'd like to say thank you for taking the time out on the Tuesday morning to listen to these Toolbox talks. Obviously, to start with, we want to remind everyone about the tips to continually prevent COVID-19. Always make sure you wash your hands, avoid touching your eyes, nose, and mouth with unwashed hands. Try to avoid close contact with people who are ill. Then cover your cough or sneeze with a flexed elbow or tissue and always throw that into the bin. And then clean and disinfect frequently touched objects and surfaces. If you can, please get vaccinated. Now, coming up for October, we're back to obviously looking at risk assessments. We want to take a look at ergonomics and how this is affecting you out there in the plumbing industry. Also, what safety file do you need? What are the differences between safety files and why is there so many different types out there? And then a question that came up from many of you, can I do my own safety? So just the thought for this week that we want to remind everybody about, especially when it comes to training. Training is a planned and systematic effort. So it is something that we really need to put effort into. It must be planned. It must also be systematic. If you do not have training needs analysis in place or some sort of training plan in place, why not try and look at exactly the type of training that is required in your company? Toolbox Talks is a part of training or continual improvement within training of your company. So this would form a part of your training management plan. If you need assistance with that, please get in touch and we'll definitely try and assist you. So let's take a look at risk assessments. The quarterly review is coming up. And one of the questions that we got is, why are risk assessments expiring? I do the same thing on projects all the time. Why do I need to constantly monitor and review my risk assessment? So the question is, Ren, why review risks? Well, generally speaking, most risk assessments will have a risk assessment procedure or a risk assessment plan. And within this, it outlines who does the risk assessment, who is then responsible for the risk assessment team, as well as who is responsible for managing that risk on site. This is generally your 2RC, your 16.2, your 8.1, 8.7 on construction, or 8.2E or 8.2I, depending on what industry you're falling in or what scope of environment you're actually working in. Then the when is this risk going to affect me, my staff? When do safety procedures need to be implemented? What is the first step? What is the last step? Remember, a hierarchy of control tells us that what we always want to try and achieve first is eliminating that risk. Then we try and substitute it. We try and isolate it. We try and put engineering controls in. We try and do some sort of administrative control. And lastly, we look at the personal protective equipment that is needed. So there is a structure to ensuring risk assessments are done. But then we also need to know what is going to be assessed in terms of risk. What are all the hazards? Have we identified everything that could affect us in terms of potential danger or hazard? Then also, how is the risk assessment going to be carried out in your organization? So this procedure or the plan will include things like a risk matrix, risk ratings, control measures to be followed. But we know, and all of you can attest to this, things change. And so what we are trying to achieve with the review is the management of this change, ensuring that we always monitor and review the changes perhaps coming onto site, the changes that we are bringing to site, the changes on the site themselves, or just regular monitoring and updating because of incident or accident in reports or statistics that we might be finding either on site or within an organization, even in an industry as a whole. Now, the reason for this is a risk assessment is the foundation of a solid safety system, and this will lead to a good safety culture. So we are going to look at 8 factors. We just want to touch on 8 things that are extremely important for us to know and understand when it comes to looking at the types of risk assessments we perform, looking at the risk assessment itself, and the need to review it and ensure that we are not just reviewing it in terms of making sure that a date has been changed and an updated revision is in place, but are we taking into consideration the individual that can be hurt, the scope of work that is being performed, and the adequacy and efficiency of mitigating those risks. At the end of the day, we really want to keep people safe. And so perhaps we need to tweak it. Perhaps there's certain areas within our working scope that we might need to change and need to adjust. And so this is what we really want to look at today. And these 8 things are what will help you to understand the people designing the risk assessments, the people who are affected on the risk assessments, and ensuring that these are the ones that are kept safe. So we look at the job specifically, and we always do that. We try and always make sure that the job is as safe as possible for the individual, but sometimes we do leave out the individual. So let us take a look at these 8 things. Number 1 is perceived control. Now, when people feel in control of a risk, they don't feel stressed by it. This has been shown to be a key factor in the acceptability of risk. So something we need to consider when it comes to the perceived control, or how much control you actually have over risk in order for it to be acceptable, is who is in control of not just the risk assessment, but the implementation of the risk assessment, the monitoring, the supervision, and the review of that risk assessment. Who explains it to you or to the team? And a question to ask yourself, if you are the one explaining it, or if it's being explained to you, do you actually know and understand the risks within that risk assessment? So it's very easy for us to sit down and listen to even myself droning on every Tuesday morning in terms of a risk assessment, Toolbox talks, and saying, great, I attended a Toolbox talk. The difference is understanding the message that we are trying to achieve. Now, this could be because it is presented in a different way that we are used to. All of us learn in different ways or at different paces. And so we need to try and adjust to consider those whom we are speaking to, consider ourselves and our own abilities when it comes to the actual risk assessment. And there's nothing wrong with getting a bit of assistance. There's nothing wrong with asking for help. You see, if you're not getting the help from your current safety officer, why not reach out? Or why not have a heart-to-heart with them? Really sit down and speak to them and tell them what it is you actually want. Now, we've heard it in the industry, safety officers are so difficult to deal with. They don't want to listen to us. They don't have enough time. And we appreciate that. All of your concerns and suggestions are obviously things that we want to hear. But if you are having an issue, drop us a mail, let us know what you're having an issue with, and let's see if we can't come to some sort of solution for you. Now, when it comes to risk assessments, again, the psychological time and risk is also a very important factor. So think of warnings about the link between smoking and lung cancer. It's been there for years. People know that there is a very big possibility that you could get lung cancer if you start smoking, and it could happen within a 40-year period. Now, that psychological time and the risk doesn't make sense to many people. And so you can put it as many times as you want on a packet of cigarettes, but really the warning doesn't really make an impact. But what about a warning in a chemical plant where workers are instructed to evacuate the workplace because a leak of a toxic substance poses the same level of risk, but the effect is not over 40 years, it is immediate. You see, they would not hesitate because their life is in immediate danger. So these are also things to consider. A lot of people feel that the risk that they are facing is long-term. The risk of ergonomic dangers, sitting and not having good posture, is not going to affect me right now. The same as smoking. Its onset of risk or danger is going to be in the future. And so we give our bodies, our healthy bodies, to our company. We bend them, we break them, we hurt them. And then years later, we sit with the consequences. And only then do we look back and say, I should have changed. I could have done it better. You see, just because you have done it and you're still alive does not necessarily mean you've been safe. Perhaps you've just been lucky. So there is a method of doing it safely, and it can perhaps impact you right now with certain risks. Other risks, the hazard where the source of exposure is coming out, might not affect you right now, but working the safe way will prevent future risks and hazards to your body. And so this is also something that we need to consider when explaining risks to individuals. Now, familiarity is another very difficult step to overcome. Research has shown that there is truth in the age-old adage, familiarity breeds contempt. People tend to underestimate familiar risks and then overestimate unfamiliar risks. So here's something to consider. You wouldn't want to use someone, you wouldn't want somebody else, to use an unlicensed plumber. So why would you use an incompetent risk assessor? See, if we are unfamiliar with risks, we tend to overestimate them. The problem is, if we've been a plumber for a very long time, we feel very familiar with the risks that we are faced with. And up to now, the psychological time and risk has told you that you've been safe up to now. And so what we tend to do is underestimate those risks that are familiar to us every single day. This means that we need to take a step back and really look at what the risk is. Now, this comes down to what we call the perception of vulnerability. The perceptions are there with people who perceive or have the perception of low vulnerability or invulnerability, such as things like they cannot be affected or have consequences of smoking. There's nothing wrong with drinking and driving. You see, people like this are not likely to modify their behavior. And because we're trying to achieve a safety culture, safety behavior, some people have an unrealistic optimism. They assume that any harmful consequences or dangers from these risks will happen to someone else. See, it hasn't happened to them in many years. I've been in this industry for 20 years. I've been in this industry for 30 years. I hear this time and time again, and we appreciate that. Your experience is valuable, but the risk is still real. But unfortunately, this type of person is more willing to take risks in all areas of their lives, including in the workplace. So again, perhaps a question you need to ask yourself: have you found yourself taking a risk to just get the job done, or because time was running out? You see, our perception of vulnerability may be that it doesn't happen to us. Accidents happen to other people. Now, this is all because of how the effects of risks are framed or presented to us. So it's very important for us to know not just the hazard and the risks that we are faced with, but how they could potentially affect us by framing it the correct way. Now, this is shown to introduce significant bias, because changing the description of a risk from positive to negative, things like talking about the cost of risk rather than the benefits, or the losses rather than the gains, will have a measurable effect on observed behavior. So people think, well, wearing a harness can save your life. For some, that doesn't really make sense. But if you tell them it could prevent you from dying, now it has more of an impact. Why is that? Because both of them say the same thing, but just in a different way. So the way we frame things, the way we present a risk assessment, risks, hazards, safe working procedures to our employees, is a very important part of how we need to review our next risk assessment that we are going to be performing. Now, all of you are coming up to the close of construction. Most of you are going to have to revise your risk assessment plans. You're going to have to look at your complete health and safety management system, your safety files, and adjust and change according to what you've seen during the year in order to get ready and prepared for January, February, when we reopen again. Most of you will be working throughout the entire building break. Some of you will even be on standby as essential services during December. Now, all of these times can affect us in negative and positive ways. For some of us, we feel we have more time to do it the safe way. We're not in a rush. See, nobody else is working. We can get the job done at our pace, and that's great. Others feel, well, because we're on break, the safety officer is not going to be there all the time. Now we can really get our work done. If you found yourself saying either of those two statements, perhaps we need to consider exactly how we view risks and hazards, especially coming now to where we have to do our quarterly review. Now, when it comes to the actual risk assessment, the risk rating procedure, you've heard us talking about percentage of risk, risk ratings, low, medium, and high, and what is the percent of vulnerability to a person when it comes to risk. Many people experience difficulty in understanding this because they cannot interpret statistical probabilities. And so what we need to do is what we call qualitative characteristic. Now, these qualitative characteristics is something measurable. It's showing the benefits and how good something is compared to just giving a percentage. So to say that a risk is low is great. On the risk assessment, it's good to do that, to show that you've got a low risk, a medium risk, and high risk, and how you're going to protect yourself from it. But a qualitative, measurable characteristic helps us to understand the risk in terms of benefiting ourselves. So something to consider is, are your risk assessments easy to understand? Are they relevant to the scope of work you're performing? Now, we do have generic risk assessments out there. Baseline risk assessments give us an overall risk, an overall higher program, if I can put it that way, for what is going to be taking place on site. But we want to not dumb it down, but what we want to achieve is making it more reasonably understandable for an individual who might not fully understand statistical analysis or statistical probabilities, looking at algorithms. Not all of us want to deal with that. We want to know who is involved, who is in charge, who is affected. What can we do to protect ourselves? What can hurt us? What must we do in order to ensure that we are safe at the end of this day? When must this be done by? What type of documentation must I do in the morning, in the afternoon, daily, weekly, monthly, etc.? And how do we go about doing this? More practical based outcomes is what you want to achieve. And this quality of risk will then come across to those whom you're speaking to, because it becomes a lot easier for us to understand how we can be affected and what we need to do to achieve a beneficial result. Now, let's just take one example, the perception of hazardous substances. Studies have shown that workers perceive risks associated with water-based pesticides. So if you're working with water, which many of you, or actually all of you plumbers do, you view water-based pesticides or diseases to be lower than solvent-based, because water is natural or inert and must therefore be a lower risk than solvent. You see, solvent is chemical. Water is not a chemical, or so we think. But this is irrational because it doesn't allow us to consider the risk of the pesticide within the water itself. So what we want to then do, again, take a step back. Let our perception of hazards in terms of waterborne diseases, waterborne pesticides, even solvents that we might use, and take a look at the actual MSDS. Now, that material safety data sheet will tell us what the risks and hazards are associated with that specific chemical. So do you work with chemicals? Do you know the risks and dangers of those chemicals? What about waterborne diseases? When working with water, do you know the dangers? And we're not just talking about water with electrical components, having the probability of electrocution, slipping and tripping on the floor if you're spilling water. We're talking about walking inside sewers, working inside areas where stagnant water has stood for a very long time. Most of you plumbers are exposed to these types of waterborne diseases. Do we know the dangers, or do we view the chemical that we're using as more dangerous than these types of illnesses, diseases, or pesticides that are water-based, just purely because water seems so natural to us. Again, it might mean that we need to change our perception. And this is going to lead us to know whether it is really a risky situation or a risky individual. Now, individual differences and situational factors can interact and prompt risk-taking behaviors. We do not want you to be a risk taker. Researchers that emphasize the significance of the individual variables have identified links between maturity, personality types, as well as risk-taking behavior. Now, here's something to think about. Regardless of the workplace controls, the individual will behave in a way that maintains the level of risk with which they were originally content. So if they felt, according to their perception, that risks and hazards don't necessarily affect them. You see, these bad consequences happen to others. Taking a look at all 8 of these factors, they don't consider waterborne illnesses as dangerous as chemicals, because we do not really understand the thing that is inside the water is actually what is dangerous, not necessarily water itself. And so this type of perception, how we receive information, how we listen, how we learn, and even how the risk assessment is designed will lead to one of 2 outcomes: a person who is going to take risks, or a situation that will become risky. So what do we really want to achieve? We want to achieve a safe working environment. That is what all of you want to achieve. All of you want to work this week looking at the weather conditions, how rain is going to affect you. All of you want to take a look at the types of tools that you are working with. You even want to know the site risk assessment. In fact, when you go to a site, is there a risk that you are not going to create? Perhaps it's created by those around you on site, other contractors, or the client's employees. Then your own risks, the tasks you're performing, as well as the tools, materials, and equipment you are going to be using. All of this is going to give you an output. And the risk assessment is what is going to assist you in ensuring you are safe. So let's give you a very basic understanding of what is a risk assessment. It is a careful examination of what in the workplace could cause harm to people, so that a decision can be made as to whether the precautions taken are satisfactory or whether more should be done to prevent harm. This is what you want to achieve. Take a look at your risk assessments, do your quarterly review, but keep these 8 points in mind. Remember, it is not just the actual risk that is going to affect me, but the people themselves that could also not understand the risk correctly, take risks, or perhaps feel that risks do not affect them. Let us remember what our safety thought is. Training is a planned and systematic effort. So when it comes to risk assessments, ensure we take a planned and systematic view to training our staff, ourselves, on risk assessments. Now, that's all for today. We hope you learned some information. Obviously, we could spend a lot more time looking at all of these 8 points in more detail, looking at risk assessments, looking at monitoring and reviewing our risk assessments, and even what more to do in order to keep ourselves safe out there. But you've done enough. You've listened to our Toolbox talk, and we thank you very much for that.